Hello, welcome to PTSD and Mdma, A Path Forward by Lisa Koklaser, University of Arizona Global Campus, Psychology 625, Biological Basis of Behavior, Dr. John Kozma, February 10th, 2025. Post-traumatic stress disorder, also known as PTSD, is a chronic illness caused by trauma exposure that affects millions of people worldwide. Typical behaviors for someone with PTSD are avoidance and interpersonal problems. PTSD symptoms are intrusive thoughts, emotional numbness, nightmares, hypervigilance, and trouble concentrating. Avoidant behavior often prevents individuals from engaging in life fully and addressing the traumatic memories. Exaggerated startle responses, insomnia, and hypervigilance are common in PTSD, which make daily functioning challenging. PTSD can lead to emotional numbness, hopelessness, and cognitive distortions about oneself and the world. The dysregulation of the amygdala, the hippocampus, and prefrontal cortex cause these symptoms and behaviors, while MDMA's capacity to increase emotional openness and cognitive flexibility allows people to confront and process symptoms in therapy. Why MDMA for PSD? Traditional treatments for PSD, while effective for some, often fail to provide lasting relief for many sufferers. MDMA, also known as 3,4-methylene dioxymethamphetamine, has emerged as a promising treatment, offering new hope through its unique pharmacological effects on the brain. MDMA-assisted psychotherapy represents a groundbreaking treatment for PTSD by directly targeting fear processing, enhancing emotional regulation, and fostering neuroplasticity. This approach offers significant advantage over traditional methods and potentially revolutionize PTSD treatment. PTSD is a psychiatric disorder that arises after experiencing or witnessing traumatic events. MDMA is a psychoactive compound known for its empathogenic and prosocial effects. MDMA was initially synthesized in the early 20th century and has recently gained attention for its potential therapeutic benefits in treating PTSD when used in controlled and clinical settings. So how does PTSD and MDMA work together for better outcomes? So PTSD is associated with dysregulation in key brain regions responsible for fear processing, emotional regulation, and memory consolidation. MDMA promotes neuroplasticity, enhancing emotional processing, and reduces fear responses, making it particularly effective in trauma therapy. Neuroplasticity is the brain's ability to organize itself and form new neural connections, allowing for emotional processing and healing. So PTSD disorder is characterized by increased activity in the amygdala, resulting in heightened fear responses, while reducing activity in the prefrontal cortex, weakened emotional regulation over fear, and cognitive control over fear. PTSD is also linked to reduced hippocampal volume, which contributes to difficulties distinguishing between past and present threats, leading to that persistent hypervigilance and intrusive memories. While we have noted structural changes, PTSD also affects the neurotransmitter system, including dysregulation of serotonin, dopamine, and norepinephrine, which contribute to mood instability and heightened stress response. The hypothalamic pituitary adrenal axis, also known as HPA, is also disrupted, leading to abnormal cortisol levels that exacerbate stress, sensitivity, and emotional dysregulation. Understanding these neural and biochemical mechanisms help inform the development of effective treatments, such as MDMA-assisted therapy, which aim to restore balance in these systems and promote emotional resilience. Clinical trials have demonstrated significant reductions in PTSD symptoms for individuals treated with MDMA-assisted psychotherapy compared to traditional methods. Traditional treatments include Selective serotonin reuptake inhibitors, SSRIs, cognitive behavior therapy, and newer interventions such as ketamine. However, MDMA-assisted therapy appears to provide more rapid and sustained system relief for many patients. We're going to take a closer look at these brain regions affected by PTSD. First is the amygdala is an almond-shaped brain structure. It is a cluster of nuclei in the temporal lobes of the brain. Emotional processing and threat detection require the amygdala. The amygdala is hyperactive in PTSD with overactive fear responses and inability to distinguish between safe and threatening stimuli. The hyperactivity produces hypervigilance and intrusive memories. MDMA decreases the amygdala hyperactivity by increasing serotonin production and enhancing emotional processing, which may help with overcoming trauma-related fears. Now let's take a look at the hippocampus. The hippocampus is adjacent to the amygdala. It is responsible for storing memories and putting them into context. When someone has PTSD, the hippocampus shows low volume and impaired functioning, which leads to re-experiencing of aggravated symptoms and difficulty discerning between past and present. MDMA may support hippocampal neuroplasticity, which can improve memory, integration, and reducing intrusive flashbacks. The increase of neuroplasticity can lead to traumatic memory reconsolidation to aid in hippocampal function, thereby facilitating trauma processing. Another area affected by PTSD is the prefrontal cortex, also known as PFC. It is often called the personality center of the brain, which is in the frontal lobe. Emotional and executive functions are controlled by the prefrontal cortex as well. The PFC hypoactivity is associated with PTSD, which impairs its ability to regulate the overactive amygdala and affective responses. MDMA releases dopamine and increases the connectivity between the prefrontal cortex and the amygdala, facilitating emotional regulation and cognitive processing. Lifespan and historical context. From childhood through adulthood, PTSD can affect anyone. Early trauma increases vulnerability to PTSD, and older adults may have worsening symptoms from age-related decline, increased risk of substance abuse disorder, and quality of life. PTSD has historically been defined as shell shock among war veterans, but research has added abuse, accidents, and disasters among these. MDMA-assisted therapy may be the first step to addressing PTSD's lasting effect and improving lifespan outcomes. So how else has the brain changed during PTSD? There is neurotransmitter dysregulation from PTSD, which includes serotonin, norepinephrine, and dopamine. Deficiencies in serotonin are linked to mood instability, while an imbalance in dopamine affects reward processing and motivation, which contribute to an inability to feel pleasure and hyperarousal. Additionally, the hypothalamic pituitary adrenal axis is disrupted, and there are elevated cortisol levels and chronic stress responses. MDMA releases serotonin, reduce anxiety, improve mood. It also modulates the HPA axis to normalize the stress responses. So let's talk about more MDMA's effect on the brain. MDMA-assisted therapy has shown efficacy in PTSD treatment. MDMA reduces PSD symptoms through enhanced emotional processing and neural connectivity in phase 3 clinical trials. The therapy uses MDMA during psychotherapy so patients can revisit traumatic memories without feeling fearful. This new treatment gives hope to those where traditional therapies have been resistant. MDMA affects the serotonin system by acting as a releaser and reuptake inhibitor at the serotonin transporters, also known as SERT, leading to increased serotonin availability in the synaptic cleft. The MDMA binds serotonin receptors, particularly the 5-HT2A and 5-HT1A receptors, which are involved in emotional processing, fear extinction, and mood regulation. The 5-HT2A receptors promote cognitive flexibility and reduce negative biases, often presented in individuals with PTSD, while the 5-HT1A receptors stimulate enhanced emotional resilience. MDMA has an influence on the brain's default mode network, which is a network of interconnected brain regions that is often hyperactive with PTSD. The default mode network is responsible for self-referential thinking and rumination, which contribute to the rigid thought patterns and emotional distress seen in patients with PTSD. MDMA affects the default mode network hyperactivity and aids in connection between the frontal cortex and limbic structures, which allows for emotional processing and improved trauma processing. By modulating the default mode network activity, MDMA therapy helps patients engage with traumatic memories in a neutral space and gives them opportunity for cognitive reframing. MDMA facilitates the neuroplasticity by increasing the synaptic connectivity and upregulating brain-derived neurotrophic factor, or BDNF, the key protein involved in neuronal growth and adaptation. These new mechanisms allow PTSD patients to restructure traumatic memories and foster long-term system relief. MDMA-assisted psychotherapy is currently in phase 3 clinical trials with encouraging outcomes so far. Regulatory hurdles remain, including concerns about possible long-term side effects, misuse, and accessibility. There will be strict guidelines, and monitoring will be imperative to ensure safe and effective use of MDMA therapy in clinical settings. With phase 3 clinical trials demonstrating success, FDA approval for MDMA-assisted therapy is anticipated hopefully in 2025. MDMA-assisted therapy is a groundbreaking approach for PTSD treatment because it can affect the neurobiological and psychological mechanisms of this disorder. MDMA helps modulate the neurotransmitter system, which involves serotonin, oxytocin, dopamine, and norepinephrine. It gives system relief from hyperarousal, intrusive memories, and avoidance behaviors, and mood changes. MDMA enhances the connection between the amygdala, the prefrontal cortex, and the hippocampus, which promotes emotional regulation and fear extinction. By reducing fear, having more emotional regulation, and creating new neural pathways, MDMA is an important healing modality compared to the traditional therapies. As research continues on MDMA-assisted therapy, it is a promising therapy for those suffering from trauma-related disorders. And thanks for listening.